Well, now let's return to our top story tonight. The panic across the country, perhaps unnecessary, but panic there is about swine flu, and particularly children getting swine flu after the young girl Rita died in Pune. First question we want to ask tonight, is testing really needed when you even got just mild symptoms? Now, joining us is Dr. Sanjeev Bagai, he's Director and Head of Department and Pediatrician at Rockland Hospital and one of the best known pediatricians in the country, and the one and only Dr. Naveen Dang, he's Director of Dr. Dang's lab, and I must admit to a certain partiality here. I keep going through and I've never grimaced or cried because I've never felt the pain. But tell me, does everybody need to go and get tested even if you've got a cold or a, sniffling nose?
Well, this question I'll deflect to Dr. Bagai because he's a clinician. He should be able to answer this question.
But I know you also have the answer, so I will come back to you. Sir, what do you think?
A couple of important points. 40% of a rough pediatric outpatient clinic every day is respiratory problems. Every fever is not influenza, and every influenza is not type A influenza, and every type A is not H1N1.
So there are
more than 150 serotypes of influenza which are floating around. For every child which we see, there may be at least 10 or 20 kids in the society who got the infection and fought it off naturally. Right. So the bottom line is there is no panic. There is no need to panic. Random screening and testing is not required.
Right.
The most important thing is a good clinical evaluation and then decide which child needs what sorts of tests.
So, doctor, I'm a parent and my child has suddenly got cold, fever. How do I not panic? I mean, you've heard of Rita dying. People say don't panic, but it's a natural reaction. So what can you tell a parent to say there's no need to panic?
I think the case fatality in influenza is extremely low. It's less than 0.5%.
That means the number of people who die of ordinary influenza.
Of severe influenza.
Severe, that is right. Not swine flu. I mean just any flu.
Of any flu. Is extremely rare.
5 in 1,000, 4 in 1,000.
It's extremely rare.
Right.
Most of these children who have fatality or complications have an underlying disorder like asthma,
or
cardiac problems, past history of respiratory illnesses, decreased immunity for other reasons. Per se, truly speaking, bottom line is there is no need to panic. There is no need to screen large samples of population like there is a panic wave all over India. Right. I think the important thing is use this test judiciously as a diagnostic tool, not as random screening.
Can I just ask you then, for an average parent who has seen their child have flu n number of times and not worried at all because it gets better after 4 or 5 days, if they get swine flu, is it just like ordinary flu?
It's exactly the same in clinical presentation. Like cold, cough, fever, like headache, like occasional vomit. There is no particular lab test which confirms or disconfirms it apart from a very sensitive test which is expensive, which Dr. Naveen Dang would be able to elaborate. But use this test judiciously. Let's not get this test done at large, all and sundry, because this is an expensive test with limited resources. We should use a practical, systematic approach.
So you're saying it's just like ordinary flu, don't worry, you'll get over it.
Absolutely.
The media is highlighting one death, but there are deaths occasionally from flu as well, if people have asthma or whatever.
This is a very, very important question. There are more than 3.5 to 4 million children who die globally every year because of respiratory illnesses, upper and lower.
Which the media doesn't highlight, but suddenly the swine flu...
There is more than 2.5 million children in India who die of gastroenteritis.
Right. So
this is not a panic situation. This is a mild, self-remitting disease. I think the government agencies have stepped in pretty well in time. The helpline numbers are there if there are any queries required. It's not important where to get the test done. The important thing is the test should be done judiciously.
Right. Let's just go to the next question, which we've been asking quite a lot on this program. Why can't private hospitals do the test? And Dr. Dang, I've got to ask you, could you do the test?
Yes.
You can?
Yes, very well, Pranav. I think there'll be quite a few private labs and hospitals in Delhi and also in India who are ready and already doing RT-PCR, that's a real-time PCR, which is the test of choice for this particular disease. I'll just take 1 minute and explain to you that influenza virus A has got many subtypes. And after that, H1N1 that we talk about has been there for a long time. This H1N1 in early 2009 mutated and became something which has now been classified as novel H1N1.
I see.
And then
so it goes back?
Yes.
7 years?
Then it started this, no, I said early 2009.
Early 2009, 7 months, sorry.
Yeah, it mutated.
Right.
And in March we started having the first cases in Mexico.
Right.
Now, once this virus was isolated, the virus was sequenced, and the primers and the probes were made, which were released somewhere in June 2009.
Right.
Now, at the moment, the only way to diagnose it is by real-time PCR. In Delhi itself, we have nearly half a dozen labs which are already using RT-PCR for doing viral testing for other diseases.
I see. So you have the equipment.
Yes.
If the government allowed you, and many other private clinics like yours, to test, how long would you be ready to start testing?
As far as I'm concerned, a matter of days. A matter of few days.
Like today is Wednesday, you'd be ready by Monday?
I'll be ready by Monday.
You could actually test by Monday. There could be many other clinics around the country who could, and we are being restricted by some archaic government law.
I won't call it archaic government law.
I'm told actually that under any epidemic, we go back to a law that's 111 years old, which says that only government hospitals can test for these things. But anyway, the fact is that you're saying you could be ready in 4 or 5 days to test for swine flu, but you're not being allowed to?
Yes, the government does not want the private sector to go in. They must be having their own reasons. We are absolutely ready. And it's my humble submission to the government that let us be ready. They should come and inspect our setups, give us clearance, see that we are up to world standards, see that we are matching the best that can be done, and we should be allowed to start. I agree with Dr. Bagai what he's saying, that lots of patients do not need it. But I'll put the other way around, that lots of patients also need it.
Right.
It may be 900 out of 1,000 which may not be needing it, but 100 will be needing it.
One more question, sir. There was this worry about when somebody goes to a lab like yours or a clinic to be tested for swine flu or take a sample being taken, they should take precautions, wear masks. Is that necessary?
But now I think this question needs to be answered, that don't we all go to malls? Don't we all go to markets? Don't we all go to cinema halls? Don't we all travel in buses? Don't we all travel by metros? Are we all wearing masks there? A patient coming to my clinic for getting a lipid profile test done or for getting even a hemoglobin test done, do I know that the patient is having swine flu or not?
And
so it's not practical,
by the way,
it's not possible.
Right, it's not practical, probably not necessary
Not
also,
necessary
because
also.
there probably are many more worse diseases you can get in malls and trains and airlines. Any case, swine flu is probably one of these. Let's move on to our last of the questions. Will the new guidelines the government has announced help? Because up to now we had this rule that even if you want to be tested in a government hospital, you had to first go to a government hospital, you'd have to be admitted for 5 days even to be tested. That they've lifted. So at least there'll be a little less pressure.
What was happening a few months back was primary contact. What is happening now, it's spreading to the secondary contacts and tertiary contacts. So we cannot quarantine a given segment of population at large. So I think keeping them even in isolation at home should be fine. What is important is to keep a high level of surveillance and vigilance. Testing can be done at particular centers, and if there are good private centers, which Dr. Dank's laboratory is and other places is, I think if the government needs the load to be extended beyond their setup, I think the private sector is pretty much ready.
I think we need to appeal to the government to allow private sector clinics like yours and many others to actually start testing. Then this extreme rush at these few centers and the bottleneck will be released. One last question. What precautions should a parent take? I'll ask both of you, just to make sure, to stop their child from getting swine flu.
I'll say nothing.
Nothing.
There's nothing which can be done about it. We are all leading a normal lives.
Right.
And more we try and take precautions, it's going to create more of a panic situation.
Right.
There's no need to get tested. The tests which are giving a biggest results, if need arises, only an RT-PCR should be asked for, and that also, as Dr. Bagai has said, judiciously,
what is an RT-PCR? You're going over my head now.
Real-time polymerase chain reaction.
Okay.
That is something like a fingerprinting.
Okay, fine.
Which gives us the exact result.
Okay. So what precautions should, if you are talking to a mother, I'm sure you're talking to lots of them worried right now every day, what do you tell them?
I think keep the treatment protocols very simple. Good nutrition, good hydration, a few days rest at home. Do not exert the child. Don't send the child to school if the child is having high-grade fever. Keep simple paracetamol as a regime for fever. Don't rush into courses of antibiotics. If the fever is lasting for more than 48 hours, get the child reviewed by a doctor. If the child has a bad cough or a breathlessness episode, have the child reviewed immediately. No need to panic. This is a simple, self-remitting disease and it will go by.
I think that's very, very reassuring. Thank you very much, Dr. Dang and Dr. Pugai. Thank you very much for joining us.